There are many reasons why a patient may need to have a tooth removed. A general dentist can repair most tooth damage with a crown, filling, or root canal procedure. However, if the damage is too severe or threatens the health of your surrounding teeth, the tooth may need to be removed. Your dentist will refer you to an oral surgeon to safely extract the tooth and explore the replacement options. At Belmont Oral Surgery and Dental Implants, we use the latest high-definition 3D imaging. This imaging gives us all the information necessary to extract the tooth and to recommend restorative treatment that is right for you. Socket preservation is performed after a tooth is extracted to restore the single tooth site to prepare the area for dental implants. Many patients prefer to replace their missing tooth with a dental implant because it is a cost-effective, permanent restoration option that blends seamlessly with their natural teeth. We work hard to ensure that you understand all of your treatment options in order to maintain your oral health and restore your smile.